The use of slow kill or soft kill protocol for the treatment of adult heartworms has been one of the more controversial things that the Heartworm Society and people who are interested in heartworm disease have faced and grappled over in some time. And this has been largely due to concerns about its contribution to resistance, which we now know does exist. I'm going to take a little bit different approach here, and we're going to talk about reasons that the slow kill approach is not really appropriate for the patient's well-being. And this is the protocol that's probably thought by most to be the best. It's complex. This is a 3-dose or split-dose protocol. You can look at it and see that it's rather complex, and it's, again, I think it's the best, it's the safest, but it's clearly the most expensive. Its complexity means that it takes a long time, so it takes probably about 4 months to complete. It's dangerous in the sense that you're giving an arsenical and you're killing heartworms, which are now embolizing into the pulmonary vasculature and causing a lot of vascular damage and inflammation. And it's expensive, probably $1,000 to $1,500 to treat the average dog with this approach. And this has caused then people to look at an alternative, which has been called soft kill. And it's also been called the trickle theory of treatment of heartworms, in which you kind of do a Chinese water torture test and kill these parasites over a long period of time. And the reason for this is that you use ivermectin at therapeutic dosages and at preventive dosages to clear the adult heartworms. And it's also called the slow approach, and the reason for that is that it takes a long period of time for this to be effective. It kills 95 to maybe 99% of the worms, but it takes about 30 months. So 2.5 years is a long time. And it's especially useful to think about that in terms of the heartworm's life expectancy, which is about 60 months. So it basically cuts their life expectancy in half. I need to add, though, that with our understanding of Wolbachia, which you can see in this photograph inside the uterus of an adult female heartworm, and you can see that with those short arrows. This, of course, is important to the well-being of the parasite, to its ability to reproduce, and when we use doxycycline, we will render the Wolbachia either completely eradicated or certainly reduced in number, and this affects the health of the parasite. So people wondered, might it be possible that this approach would be useful in this so-called slow kill approach? And so it turns out that the soft kill, slow kill, trickle kill is enhanced by the use of concurrent doxycycline for 30 days at 10 mg per kilogram twice a day. And the studies that have looked at this include one by John McCall, which showed that the number of adults was reduced compared to control by 78% at 9 months, and a second one by Grande and colleagues in which dogs became antigen negative, 73% of them by 300 days. So roughly a year to get equivalent results with what it takes to get with ivermectin alone. I also want to add that the combination of ivermectin or moxidectin imidacloprid with doxycycline is also useful, and this reduces or eliminates microfilariae, and this largely takes away concerns about resistance. So the treatment that's used by people, what percentage of the veterinarians in this room, for example, or at the NAVC, choose to use a soft kill, slow kill approach over the more aggressive use of melarsoline. In 2012, I did a survey at this meeting of about 200 veterinarians, and I asked them those questions that you can see, basically trying to get a handle on what was their primary approach to heartworm disease. And the results are shown for you here, with the purple being the Those people that use the 3-dose protocol, which we would consider to be ideal, you can't see the numbers, but with the concerns are A and B, which are ivermectin with doxy soft kill, and the red is ivermectin soft kill alone. And you can see about 17% of the veterinarians surveyed then used a soft kill approach of some kind. Happily, 2/3 of them used it with doxycycline. So while not ideal, that's the better choice. That 7%, those of you who use this approach, I would hope that you will think differently from this point forward. So what's wrong with using the slow kill, soft kill approach? Well, one is you're taking a person who's let their dog get heartworms and saying, now we need to treat for 2.5 years and not miss a dose of ivermectin to get rid of this parasite. And if you look at this window of infection tool, at the far left, what you see is a red dot, which represents a positive heartworm test in an individual dog. And this was in November of 2008. The dog was treated for heartworms using imidacide, melarsoline, and was then started on heartworm preventive. And the blue star suggests the onset of that therapy, and the 6 dots following suggests that these people bought a 6-pack, so to speak, and they carried it out for about 6 months. They stopped, and they came back in for their next recheck at the middle of the screen, and that blue dot shows that they bought now a 12-pack of preventive. The dog was negative at that time. But if you look, that long red gap leading up to that, that 6 months gap in which they didn't purchase, was in July, August, September, and that's the time, of course, in the Mississippi Delta in which you're really, really apt to get heartworms if you're not on preventive. And lo and behold, you can see at the far right, when they came back for the 3rd yearly test, the dog was back positive again. And this is the concern about using the slow kill, soft kill approaches. These people are not likely to be as reliable as you would like them to be. In addition to that, it doesn't take into consideration the dogs who spit pills out. It doesn't take into consideration the amount of time that this involves. I mean, 2.5 years is a long time to expect these clients to carry this out. Even with the use of doxycycline, it's at least a year before we're going to eradicate this parasite. And what is really concerning about that is, when do you exercise these dogs? We absolutely know that they should be exercise restricted to reduce the pulmonary thromboembolic complications of heartworms, and yet we are using an approach in which we don't know even when the parasites die. The time that it takes to kill them is important, maybe more important in another way, and that's that the disease continues to progress. So the heart and lung disease continues to progress during this period of time. The kidney disease has not been studied, but one would assume, since this is related to antigen-antibody complexing in the glomerulus, that it continues to progress. And the chronic inflammation, no one has looked at this, but these dogs absolutely have chronic inflammation going on, which is affecting the pulmonary vasculature and the lung. And we know lots of things that happen that are not good when we have the presence of chronic inflammation. And then lastly, we're not going to talk much about it, but it raises the question of resistance. And so I'll say one thing about that. The map you see there shows the 6 isolates of from dogs who had resistant heartworms, were proven to be resistant in trials, and we now know that resistance exists. And there are those who think that slow kill plays a significant role in that. There are those who believe it absolutely is the cause of what's gone on in the Mississippi Delta, and there are those who think that it may contribute. We don't really know exactly, but this is one thing that we can do in the fight against resistance, is to not use the slow kill approach. So I promised you a patient focus, and that's where I'm going to turn to it now. And this was a study that was carried out about 15 years ago. Clarence Rawlings, Dwight Bowman, who you know, and David Stansfield, who happens to be in the audience today, an old friend, carried out this study. And it was a long and a hard study and an expensive study. The total study lasted about 18 months. And they used 56 dogs. And these dogs were divided into 3 groups. One, which received milbemycin, which will show up as blue. Milbemycin oxime is a very good preventive, but it does not have adulticidal effects. The second group were given ivermectin, and this was the soft kill group. So that group was going to have the worms supposedly eradicated, and then there were 8 dogs that were used as controls in which they received nothing, and they'll show up in red. So the 100 infective larvae were given to these dogs, all 56 of them, on day 0. And then a time was waited. So for the control dogs, obviously there was no reason to wait for those. They were in the study and they were in it 1 year. The next group, which received both, 6 of them got milbemycin oxime and 6 of them got ivermectin, meaning that they got either preventive or prevented that was a slow kill, and began at 3.5 months. Next group began at 4.5 months, next group at 5.5 months, and then finally the final group began at 6.5 months. They were all necropsied a year after they began their therapy, and that was the end of the study. So I want to put this into a time perspective for you using a figure that was developed by Catani and Powers, and it shows you the timing of larval molts. And you can see on the far left that in the first week after infection, we have a molt from the L3 to the L4 stage, and then the L4 stage to the immature adult stage occurs beginning around 60 days. So if you look at that blue arrow, that's at 70 days, and that's when you can assume now that all the developing heartworms have reached the adult stage. The 2 red arrows at the bottom right show you when the first 2 groups were started on their preventive. So they were started at 3.5 and 4.5 months, well after these parasites have matured to the adult stage, but they're still not mature adults. They're not full grown. They're not reproducing adults. And that then gives us kind of a marker here, you can see, in which we have divided those that are immature adults. And then on the right of that dashed line I just showed you, we've got the mature adults. So we're going to now look at what happens if you give this medication to youthful parasites, developing parasites, as compared to mature adult heartworms. And in these 2 graphs, I took these from Dr. Stansfield's study, and what we see on your left is the 3.5-month group, so immature, and on the right are the 5.5-month groups. Remember, red is the control group, and the green is the slow kill group, and blue is the milbemycin oxime group. So they start off, in this case, with interstitial grades of 0, and you can see that at your left. And then beginning at day 120 or so, they start to receive their preventive. And what you see is that the lesions are significantly more severe in the control dogs and in the dogs that are receiving soft kill. Probably the reason the dogs that are receiving soft kill are worse is because you're killing off these worms, these immature adult worms, and they're producing inflammation, which we know happens when heartworms die. The body hates heartworms, but it really hates dead heartworms. And interestingly, I don't know that I can explain why, but the milbemycin group were significantly better until you get to the end of the study. And at the end of the study, at the end of the year-long treatment, there was no significant difference between any of the groups, even when they started young. If you look at the last dot, though that didn't reach statistical significance, would suggest once again that maybe the soft kill was actually a little more dangerous in producing inflammation than was the just preventive dose. Now let's look at what happens when you give this to adult heartworms, and that's what we're talking about, is a slow or soft kill approach to adult heartworms. So the 5.5-month group are shown for you here, and we're looking again at the interstitial disease, and we see that it starts at 0, and then at about 170 days, you can see that it's advanced in all groups. You have virtually identical curves between the control groups that got nothing, the group that got slow kill, and the group that got just preventive. So absolutely no benefit to the dog in terms of the lung disease over the year. Similar results were seen on postmortem samples that were collected at the end of the study. So there were no significant differences between the group in the degree of pathology of the lungs and of the pulmonary vasculature. The last thing I want to show you from this study is something to do with functional data. Now, these dogs weren't catheterized, there were no functional data obtained, but the size of the pulmonary arteries will give us some idea as to how significant the pulmonary hypertension was. And so if you look, they started off with a ratio of the pulmonary artery to the pulmonary vein of about 1. And you can see that once again, the dogs that did not have slow kill at certain time points were significantly less severely affected in terms of pulmonary hypertension than were the dogs who got slow kill, probably because of the, again, the death of these parasites. As we move over to the mature parasites on your right, again, this is really what we're talking about, is the use of slow kill in adult heartworms, and what you see is that there's absolutely no difference between the curves. Once again, the degree of pulmonary hypertension is the same in the dogs that are untreated but get a preventive, or given slow kill, soft kill. The final parts of this are shown for you here. At 3.5 months, I just want to point out that 2 of the ivermectin-treated dogs had no adults at necropsy, although they were antigen positive still. At 4.5 months, the lesions in the arterioles of the ivermectin-treated, the slow-kill-treated dogs, was more severe than it was in those that received milbemycin oxime. And if we look at this radiograph, we can see the lesions from that study, this caudal lobar pulmonary artery change that we see so frequently with heartworm disease was significantly more severe, as read out in a blinded fashion by a veterinary radiologist in the dogs that were receiving were receiving ivermectin. Lastly, at both 5 and 6 months, there were no differences in the lesion severity between the slow kill, ivermectin, and the preventive only milbemycin oxime group in mature heartworms. And so we can conclude then that soft kill, and this is ivermectin, I need to point out, without doxycycline. There are no data of this with doxycycline in terms of the severity of the lesions. Administered to dogs with adult heartworm does not reduce lung or pulmonary vessel pathology in the first year. In fact, slow kill worsens lesions when administered to dogs with younger heartworms, presumably by killing maturing worms. I want to close with a study that came from our colleagues in Italy, Venko and Genci and John McCall and Jorge Guerrero all worked on this study. And this was a study that looked at dogs with naturally occurring heartworm infection. And there were 14 dogs with heartworms, client-owned, and they all received ivermectin as a slow kill agent given to them for 24 months. And I think the results are quite informative. What they found was, first of all, that the dogs were free of microfilaria. 100% of them were free of microfilaria at 4 months. They found that 3 of the dogs remained antigen positive, so 3 of the dogs still had heartworms at the end of 24 months. And then lastly, and most interestingly, I'll be interested to see how this shows up. Those are supposed to be dogs. There's a blue dog, a red dog, and a yellow dog there. What I want to point out to you is that these dogs all suffered worsening of their radiographic and echocardiographic lesions, meaning then that they had pulmonary thromboembolic disease with inflammation, and the right side of the heart was affected by this. In addition to that, one of them, that dog, is the same as the dog in the heartworm antigen positive group. So what I mean by that is that was the same dog. So this dog not only still had heartworms, this dog developed pulmonary thromboembolism and had 24 months of chronic heartworm disease with this slow kill protocol. So I don't think that was a real bargain. And what I would conclude then from this is that regarding slow kill is that 1, slow kill is slow. And that does not work to our advantage in any way. 2, the disease continues to progress. 3, there are serious consequences, including pulmonary thromboembolism, can result in individual dogs so treated. It's not 100% effective, and no one ever said it was, but I think it's worth keeping that in mind. It may contribute to macrocyclic lactone-resistant heartworms. That's certainly a concern we need to be wary of. And then I would just say that I think that this slow kill approach should be avoided if at all possible, realizing that sometimes we get pushed into a corner. If you are pushed into a corner, my suggestion is that these dogs receive 30 days of doxycycline therapy at 10 mg per kg twice a day, as suggested by the American Heartworm Society. Thank you very much.